So we are here today with Miss Layla and her mom, and we just had our big smile reveal day, and we're so excited. Layla went through surgical orthodontics, where we worked in concert with the oral surgeon to establish her bite, not only dentally but also the skeletal base, where we had upper jaw moved, lower jaw moved, in order to then align both the jaws and the teeth. So we're going to ask Layla and her mom a few questions. The first being, why did y'all decide to do orthodontic treatment?
So for most of my childhood, I had a very protruding underbite, kind of. And I've just been waiting for braces, any type of start to get it to where it is now. So yeah.
Yeah, and then what were some of your concerns about going through treatment, Mom? This is more for you because this was your little baby that we were talking about.
So when we first started and we first noticed was when she went to the dentist to get a cleaning.
Yes.
And he's the one that said, oh, you have this. And we always knew there was something, but we didn't know it was to the extent that it was.
Right.
And he had the same surgery, so he helped us and explained to us. And then he directed us to you guys. And just her eating alone and being embarrassed to eat in front of people, and you would just see her kind of like bring herself in and down. Like she had to eat pizza from the side. She couldn't bite from the bottom because her jaws didn't meet up to basically to tear the food apart. And she was always to herself, where now she's glowing. She's doing a lot better.
Like I smile so much.
Do you?
Yes.
And that's what I tell everybody. Even with braces, she smiles. Before, I'm like, I would have to pull all her. We have to redo graduation pictures. We have to redo senior photos, because before I'm like, smile with your meat. No. So then after that, she had surgery during the summer,
Right.
and so that helped a lot.
So you saw changes, Mom, you're saying, in how much she was smiling.
Her mental. I get really emotional about it because her mental state got really bad towards the last couple of months before surgery, because it was just progressively getting worse as she was getting. It was still dragging. When she got her wisdom teeth out, her teeth were dropping. And so they noticed that as well. You guys let us know their teeth were dropping because the wisdom teeth were gone. And then sleeping, she was sleeping with her mouth open, even like in the car or in the couch or on the bed. Like she would sleep with her mouth open and then wake up in the middle of the night. Just, they knew she was doing that. Now she sleeps with her mouth closed. She sleeps through the night. She wakes up in a better mood.
Like the quality is so much better.
So the quality of your sleep, and you've noticed this, right?
Yeah, for sure. Like I feel like my dreams are very vivid now. Like before, they wouldn't get as vivid. It's crazy.
And what about when you wake up in the morning? How do you feel?
Like actually refreshed, like how you're supposed to when you sleep.
And that is key. That is called getting good restorative sleep. And when we get that good restorative sleep, you're going to see every aspect of your overall well-being improve. And Mom, you hit the first one, mental well-being, your cognitive ability to think, to function, right?
Right. I feel like my focus is better.
Her focus is no longer here. Her focus is here.
Like when I'm in public, I remember before I would situate my teeth to where it wasn't so obvious. Like I wouldn't. I would never.
She knew her angles. Girlfriend knew her angles. She would never take a picture, side picture.
That's
or
right.
Anything like that. Everything was up front. So
that's what happens.
Like I couldn't just.
We camouflage. We try to camouflage.
Absolutely.
So we'll either do this. Our patients who have deficient lower jaw, they'll kind of do this.
Mm-hmm.
So yes, we camouflage it, our posture, without even being aware that we're doing it, right?
Yeah.
Like I remember my brother would ask me do you do anything that you don't to disguise it, I guess, and I said no, but then it took me a while to realize finally I did. Just not even
probably the way even you do your hair to kind of cover the where now possibly you feel more comfortable tying it back.
Tying it back.
Exactly.
Yeah.
So thank you guys. I want to truly thank both of y'all for trusting us, trusting our practice, because Mom, this is your baby girl.
Oh, yeah.
And this is it is an extensive type of treatment that we chose to do. for her overall well-being. So thank you so much for your trust in our practice. I am so pleased with the result. Not only the skeletal jaw, I'm also pleased with the dental alignment, and overall just your testimonial about your overall well-being, sleep being key here. And then of course the confidence is given you.
Absolutely.
Especially now that you're off to college.
Like a lot of people say about my smile, they'll be like, oh my gosh, your smile's so pretty. It's just crazy hearing that now, because going from that to having that be my feature on my face, it's just crazy.
It's one of the highlights.
I love it.
And of course I love your dimples.